see so many clients come in that have made investments that they wish they didn't or they don't totally understand. And so I feel really strongly that education is the key.
Welcome to Money Talk, serving individual investors and retirees. Welcome back to Money Talk. I'm David Wolf. In this segment, we're going to be visiting with an industry expert on the subject of hospice and hospice care. Joining us in the studio is Sara Crutchfield. She's the owner of High Desert Hospice. Sara, I'll talk a little bit about you. Welcome to the program.
Thank you so much for having me. It's a pleasure to be here.
So as I understand it, you started out in the medical field at age 15 as a volunteer candy striper and then went on to become a certified nursing assistant or a CNA. And then from there, a respiratory and hemodialysis therapist. How did I do with that word?
Pretty darn good.
All right, good. And from there, and this is quite impressive, you were involved with pancreas and kidney transplants.
Yes,
Wow.
I was on the transplant team for many years.
Wow. 8 years as a therapist, you began your career in hospice as a community liaison, worked as a liaison for 12 years and with several companies, ultimately starting your own.
Yes.
What drove you to start your own company?
Well, I'm not a big corporate girl, so I'm more of a grassroots, let's get down to business, let's provide good quality care to our community. And that's really what motivates me, what made me start High Desert Hospice, because I knew we could do it better. I knew there was a better way.
Yeah, you have talked about a better way. If I were to ask you, what are some of the things that you thought were flawed or wrong or just not working in the industry, how would you start or how would you respond?
You know, one of the things is a lot of people don't understand that Medicare gives us one lump sum to take care of a patient on hospice. That's to cover durable medical equipment, medications, nursing services, CNA, a therapist, chaplain, all of that is inclusive. And I just got to the point where, no, you can't take out those supplies. No, you can't have that durable medical equipment. No, we can't pay for those medications. And it's not all about the profit. If you do the right things for the right reasons, the business will come.
You've also said, Sara, that the medical industry has lost its personal touch. I guess many of us, we have a studio audience today, would agree that there is something missing now. Talk about that a little bit.
And, well, you know, I don't believe that you should be treated like cattle. Now, granted, I'm a farm girl, so that some people might take offense to that. But, you know, it should be more personal. I should not have to worry about the doc looking, TikTok, you've been in here 5 minutes, you need to go out, I got to meet my quota. And the way the insurance companies run nowadays is that you have a quota you have to meet. You have to see X amount of patients within a day. And a lot of times you don't get the individualized attention that you need.
Yeah. We're getting this misincentivized force that plays into all of it, and it's not good for the patient.
No. Well, and it's not good for the physicians either, because it's essentially they're getting their hands tied. And I don't want to say that physicians don't care. I mean, they're in the business to care for patients. And, you know, to some extent, their hands are tied.
Understood. Let's switch gears a little bit, Sara. Some of the basic needs to know about hospice. I mean, for many of us, this remains a mysterious world that you live in and know so well. So let's just start from the very top. What is hospice care? How do you define it?
It's comfort care. It's palliative care. Everything that we do is geared towards the patient. Now, a lot of people think that it's the H word. Nobody wants to go to hospice because it's a place they go to die.
Right.
That is so not true. Hospice is wherever you call home, whether it's in a nursing home, whether it's in your private home, whether it's in an assisted living. We've even provided end-of-life care to a man that was homeless underneath a bridge.
Unbelievable.
Home, it could be anything.
Yeah.
You know, wherever you hang your hat, that's where home is, and that's where hospice can provide care.
And I was going to ask the where question. Where is this done? Where is hospice care implemented or done?
Yeah, in the comfort of your own home.
Wow.
So anybody can make a hospice referral. A lot of people think that, it has to come from a hospital when you've been diagnosed and you have days left. That's not true. The benefit is for 6 months. So anybody can make a hospice referral. Anybody can say, you know what, Mom hasn't been eating. She's had a couple of falls. She's lost a bunch of weight. She's not doing well. Her memory isn't the way it used to be. I'm really concerned. Make that call.
So it's not necessarily like you said, this destination for death.
Right.
That's not the way to think of it. But yet we have been conditioned to think of hospice as the last stop.
Exactly.
So it can be a 6-month run or less.
Or more. As
Okay.
long as they continue to decline and meet criteria, we have very specific guidelines that we have to follow. And Medicare has carved out this piece that says if they're on for cardiac disease, these are the criteria. This is what they have to continue to meet to stay on hospice. This is the criteria for somebody with end-stage lung disease. This is what they need to
Okay, so for each condition, there may be a new set of criteria that
Correct.
you're mandated to follow in order to comply and all of
Yes.
that. Okay, all right. I was going to ask what the criteria is, but it depends on what the issues are.
That's correct.
Okay, all right, great. And so in your practice at High Desert, where does the process begin with a family or with a patient or?
It begins with a phone call because anybody can make a referral. So we have many different referral sources. We have community-based, we have web-based, we have hospital-based referrals, physician-based referrals. It all starts with that phone call. And a lot of what I do as a provider to hospice is education. And we go out, we meet with the family, we explain what the benefit is, talk about the pros and the cons, what we can do, what we can't do, and then give the family the education and so that they can make the best choice that's appropriate for them.
It's interesting you said some things you can't do, and so it would be interesting to just kind of come in through the side door. What are some examples of things you can't do that we might think you can?
So let's take a very cut and dry diagnosis. So you have somebody with end-stage cancer. When they come on for hospice for, let's just say, end-stage breast cancer, we're not going to give them aggressive treatment for that. We're not going to do radiation. We're not going to do chemotherapy. They have to be at the point where they're saying, I've done that. I've exhausted my possibilities, and I'm not going to go there anymore.
I see.
So at that point, they can say, I'm done with the aggressive treatment. I want comfort meds. I would like, I want to make the best of whatever time I have left, and we can go for that. So that's that's kind of cut and dry.
I think you answered this maybe, but I just want to approach it again. Is hospice care really... Is it fair to say that it leans towards pain control, or is it?
It is, and we evaluate pain on every single visit. That is one of the main things that we address with families, and pain can be many things. It can be physical pain, it can be emotional pain, it can be psychological pain.
Sure.
And we address all of those issues. That's why we have a social worker. That's why we have a chaplain. I mean, we try, and it's not just the physical aspect of a patient. It's multifaceted.
Yeah, a lot of ways to define pain in this world. And I'm guessing it's age agnostic, right? Mm-hmm. I mean, you've got people of all different ages that are dealing with issues that hospice would be helpful for.
And we also are seeing patients that, a lot of times, not only do they think hospice is the last stop on the train, but they also think that you have to be in your 90s to qualify, and it's like, that's so not true. We are seeing younger and younger patients. Unfortunately, that's just the reality of it.
All right. Thank you for that. We're visiting with Sara Crutchfield. She is the owner and administrator at High Desert Hospice. That's www.highdeserthospice.care.
Correct.
Good, I got it right. And you have an Albuquerque and a Las Cruces office, which is beautiful.
Yes, we do.
All right, good. So good coverage in New Mexico. Let's talk about the economics. What do we need to know? What are some of the questions I should be asking you about who pays for this and how does all that work?
That's a very common question. And one thing that you always have to ask and not be afraid is, what is covered, what is not covered? What am I giving up? Because sometimes there are some non-negotiables that we cannot maneuver around dealing with the Medicare benefit. Hospice is the only benefit that reverts back to straight Medicare every single time. So it doesn't matter what senior plan you have, it always reverts back to straight Medicare. So that being said, it is very clear as to what Medicare will pay for, what Medicare allows us to bill. So if they're on for cardiac, anything cardiac is my responsibility. I have to pay for all of those medications. Say that then we have something for toe fungus. We can't pay for that.
Okay.
I mean, it's very specific as to what we can pay for, what we can't pay for.
Yeah, it strikes me as almost like an a la carte, if you pardon the expression, menu of things you can do that are paid for and covered by Medicare and then not.
Correct.
And you just have to follow that
We
list.
have to follow the guidelines.
Yeah.
So a couple of things is people think, well, what do I get with hospice? Well, it's kind of easier to say, what don't you get? Because you get the whole cow. So all durable medical equipment is paid for at 100%. Wheelchair, walker, shower chair, full electric bed,
Wow.
specialty mattress, briefs, wipes, chucks, pull-ups, gloves, butt paste, shampoo, conditioner, deodorant. That's all covered at 100%. At least my hospice does.
Okay.
All medications related to the diagnosis, pain, constipation meds, those are all covered. You look at the nursing services. You look at social work, chaplain, CNA, which is a certified nursing assistant. You have physicians that come out and do home visits. We have a nurse practitioner that comes out and does home visits. We're on call 24 hours a day, 7 days a week, 365 days a year. So you don't have the ER. We manage everything with that patient. So what do you give up? Well, you don't have to go to the ER anymore for that. If mom's having chest pain, you pick up the phone, you call me, we come out.
Wow.
So we manage everything when it comes to a hospice patient.
How large a staff do you have these days?
I have 44 employees here in Albuquerque.
Oh my gosh! So you have a fairly large office then. In that
Yes, we
case.
do.
Yeah. Okay.
Yes, we do.
So, but most of it happens at the patient's houses, if I'm understanding right.
Everything happens at home.
So it's not like a clinic where you would go.
No, everything, we come to you.
It's an outbound kind of situation. When a patient dies, does High Desert offer services after the death?
Absolutely. That's part of the Medicare benefit. We offer bereavement services for 13 months after their loved one passes.
Perfect.
That's standard. A lot of people also wonder, well, what do I do when my loved one passes? Nobody wants to talk about what happens after they pass.
Yeah.
But that's also something that we take care of. We take care of postmortem care. We coordinate with the mortuary. They come out. We pronounce.
Oh, wow.
Our physician signs off on the death certificate. I mean, it's all buttoned up in a nice little package.
Wow, that's really, really good to know. High Desert Hospice. HighDesertHospice.care is the website for those just joining us. What didn't I ask you that I should ask you? What did we?
Well, we kind of hit just about everything, but I think the most important thing is that people need to not be afraid of hospice. It is not something to be afraid of. It is not a scary thing. The thought of death, we are all dying. The day we are born is the day we start dying. It happens. It's a natural process. Embrace hospice. Look at the benefits. Don't be afraid of it. There are so many benefits that are out there, and it's free. It doesn't cost you a penny. One of the other things that we also do is we've never once collected for a non-funded patient. I don't believe in it. And again, that's the philosophy of our company. We do the right things for the right reasons. The business will come. If families don't have the money for the copays, a lot of times with private insurance, there's a significant copay. We've never once charged a family for that. A lot of the commercial insurances will only pay for a hospice benefit for 3 months. Most of the time, you're going to burn up those 3 months and you're still going to have your loved one that's still there. We will not leave you stranded. We will not abandon you. We will continue to care for your loved one.
You're doing some great work.
So, I mean, that's one of the things that you also need to make sure that you make an informed choice, because a lot of times, okay, you've made the decision to go on hospice, which is huge, because there's two decisions that families have to make. One is placement. The second is hospice when we're dealing with end of life.
Okay.
And when you have to deal with that, the last thing you want to have to worry about is, where's this care going to come from? Is the benefit going to end? How am I going to do this? Because it's a scary thing. It's a very scary thing for families.
Great work you're doing.
Thank you.
That's really good. Thanks for joining us. Sara Crutchfield, she's the owner and administrator at HighDesertHospice.care. That's the website. You can reach her in Albuquerque or in Las Cruces. So check them out online. Thanks, Sara.
Thank you.
Thanks for listening to Money Talk, serving individual investors and retirees. Learn more at Alex.com. That's ALYXNM.com.